Let's discuss the Chinese medical theory, the Chinese versus Western medicine part 3. To illustrate the difference between the TCM and the modern Western medical approach to illness, take a common example of a patient who has just recovered from influenza. He is free of virus but has a persistent cough with yellowish or greenish bacterially infected sputum. Suffers from weakness and irritability and feels dry in the throat and warm in the body even though his temperature is normal. His tongue is red with a thick layer of yellowish cover. Or from TCM diagnosis, these are the classic symptoms of internal heat with warm phlegm. Treatment consists of using cooling herbs that, according to the Chinese pharmacopoeia, reduce and eliminate internal heat as well as other herbs that resolve phlegm. A week of herbal medication usually solves the problem, but if the patient is run down and feeble, it could take longer. At this stage, if the patient to need assistance dealing with bacterial infection, he may decide to prescribe a Western antibiotic to supplement the herbal prescription. After the cough and internal heat have subsided, a Chinese medical tonic may be prescribed to enhance the body's ability to restore balance and prevent a relapse. The Western doctor would typically view the patient as having sputum in his respiratory system because of a secondary bacterial infection. The patient feeling of body warmth and irritability merely a transient after effect of the viral infection. The usual treatment would be a course of antibiotics to kill off the bacteria and an expectorant to deal with the sputum. It is not uncommon for such a condition to require repeated doses of antibiotics if the infection returns after the antibiotics are stopped. After the sputum dries up, a dry, persistent cough often follows that could drag on for weeks. The TCM physician in Asia often encounters such patients whose cough have not recovered with Western medicine and therefore seek alternative treatments. There appears to be some anecdotal evidence that such patients find faster and more permanent relief with herbal treatments that aim in clearing heat and phlegm and rebalancing the body. In this example, the TCM physician uses what he considered a holistic view of symptoms presented by the patient, which enables him to draw conclusion about the nature of imbalance in the patient's body. In TCM parlance, the patient's imbalance is caused by internal heat and phlegm. This approach is different from that of Western medicine based on cellular biology, which aims at eliminating an offending microbiological pathogen, bacterium found in sputum, and inducing the lungs to throw off the sputum that causes discomfort, this being the role of expectorant. Can the two approaches be reconciled? It is tempting to give biomedical interpretations to the TCM medications. Perhaps the herbs have antibiotic and expectorant properties. Many Chinese herbs do indeed have antibiotic properties, but in forms too attenuated to be really effective in killing the bacteria involved. Herbs for resolving phlegm are deemed in TCM theory to have the effect of stopping the body from producing sputum rather than just expelling it. The modern TCM physician, drawing on his Western medical training, would view the bacterial infection as a consequence of the underlying imbalances in the body. The underlying condition, the imbalances, is internal heat and phlegm. Its presence encourages secondary bacterial infection to take hold. Hence, the real solution is not to kill the bacteria, but remove the root of the problem, namely eliminate internal heat and phlegm and thereby restore balance. With internal balance, restore the body's own defenses, overcome the bacteria eventually. When the TCM physician adds the antibiotic, the aim is to assist weaker patients particularly the elderly whose body defense take too long or inadequate for a satisfactory recovery. In this latter respect, the TCM physician approach is not unlike that of more conservative Western physicians who would not prescribe antibiotics for a condition such as the one described above, except as a last resort for frail patients with life-threatening infections. The conservative doctor prefers the body to use its own immune system to overcome the infection, thereby strengthening it for further battles, but also reducing the incidence of bacterial mutation and becoming resistant to the antibiotic use. Thank you for your attention.